Hello everyone, I'm Dr. Chioma Innocent. I'm an optometrist and an eye health educator. I love to write and educate about the human eyes. Today I'm going to be educating you about your eyes and diabetes. What's the goal of this video? The goal is simply to educate you on how diabetes affects your eyes and how to prevent blindness that comes as a result of uncontrolled or prolonged diabetes. If you stay to the end of this video, I'm definitely going to show you exactly how not to go blind from diabetes. What's my passion? What drives me? As an eye doctor who sees not less than 15 patients daily, I've come to realize the fact that out of an average of 20 patients who visit the clinic on a daily basis, 5 are diabetic with very poor vision. And that's because they have uncontrolled diabetes or prolonged diabetes. This has actually laid a burden in my heart because I know most of these people do not choose to be blind. Rather, most of them were simply ignorant. And that's the reason why I'm here today, to help you listening to me, prevent blindness that comes from diabetes. Now, what's my story? Out of all the cases I've treated, one particular case got to me. It's a case of a 45-year-old mom of 4 who was led into my consulting room on a wheelchair. It was obvious she was lame because her left leg was already amputated and she couldn't see either. I asked her to explain the reason she reported to the clinic that very morning, and all she could say amidst tears rolling down her cheeks was, "Doc, had I known, I would have taken my health more serious. Trust me, I could feel her pain." After running some tests on her and examining her, I discovered she'd had uncontrolled diabetes for a very long time, and that had contributed to all the complications she's been experiencing. While I was examining her, I asked her for some of the symptoms she experienced, and she told me that the first was blurry vision. If you stayed with me up to this point in this video, definitely you will need to listen to me very well, because most of these symptoms she complained about are the symptoms people experience whenever they have diabetic retinopathy. That is a disease of the eye that occurs when you have diabetes. Apart from blurry vision, she said she saw black spots in her field of view. I know most of us see this. She told me that at times when she wants to take a cup of water, she sees black spots inside. She thinks the water is dirty, but obviously it's not in the water, it's in her eyes. Wow. She also complained of seeing floaters. She said at times it looks as if there's cobweb covering her eyes, or she also said it looks as if flies are passing her eyes, but she can't touch them. That can be very frustrating, trust me. She also complained of constant changing of her glasses. Now I'm going to explain this for you. This actually happens when people have diabetes and they don't control it. What happens when a patient is diabetic, the vision in the eye reduces, and the patient comes to the hospital and requests for glasses. If at this point you get glasses, after a few months or after a few weeks, if your sugar level should drop, you're definitely not going to see very well without glasses again. And that means you have to come back to the hospital. And if the examination is not done well, you'll be given another glasses. So what am I trying to say? I'm trying to say that if your sugar level becomes high, your vision will change. When your sugar level reduces or becomes low, your vision changes. And this is why diabetic patients are always changing their glasses frequently. She also complained about trouble with night vision. Wow. She told me she could no longer drive again because her vision, especially at night, was reduced. This is a common symptom too. She also complained of distorted vision. When I heard of distorted vision, I knew that her problem had gone far. And you know one thing with diabetes in the eye, whenever diabetes causes problem in the eyes, the problem is permanent. It cannot be reversed. So just a quick review. What is diabetes? I know we already know what diabetes is, but let's just give a quick recap of what it is. According to WHO, the World Health Organization, diabetes is a metabolic disease characterized by elevated levels of blood sugar, which over time leads to serious damages. And this can occur in the heart. The heart can become damaged, the kidneys can become damaged, the nerves can become damaged, and overall your eyes can also become damaged, leading to permanent blindness if not found out or discovered and controlled on time. Now we have various types of diabetes, but I'm going to be talking about the 2 most common types that everyone is conversant with, which is what we all call type 1 diabetes. In type 1 diabetes, the pancreas cannot produce insulin. This means that the insulin which is supposed to carry the sugar from the blood into various parts of the body like the skeletal muscles and the liver can no longer happen. Reason, pancreas cannot produce this insulin. The second type is what is called type 2. In type 2 diabetes, the pancreas actually produces the insulin, but the body does not respond to insulin, leading to increased sugar level in the blood. Now we have to take note of a few things. One, whether you're having type 1 diabetes or type 2 diabetes, your eyes are going to be affected the same way. Remember, this video is all about how diabetes can affect the eyes and how to prevent the permanent blindness that comes from uncontrolled diabetes. So yes, whether you're suffering from type 1 or type 2 diabetes, your eyes are going to be affected exactly the same way. The second thing you're supposed to take note of is, one, the changes in the eye will depend largely on two major things, which are how long you've been suffering from diabetes, two, how well you've been controlling it. So if you've suffered from diabetes for a long period of time, definitely there's going to be damage to the eyes. If you've been controlling it or if you've not been controlling it, there's also going to be damage caused to the eyes. Now to our topic proper today, diabetic retinopathy. I'm going to be explaining this one by one. Diabetic means from diabetes or caused by diabetes. Retin means retina, and retina is the most sensitive part of the human eye. Pathy means disease. Therefore, we can say that diabetic retinopathy is a disease of the blood vessels of the eye retina caused by uncontrolled or prolonged diabetes. This means that diabetic retinopathy occurs in the eye when someone has prolonged or uncontrolled diabetes. Another thing you need to know about diabetic retinopathy is that it affects 25% of the total diabetic population. You also need to know that permanent blindness occurs in adults 20 to 74 years of age if they are suffering from diabetes. The third thing you need to know is that diabetic retinopathy is one of the leading causes of blindness in the world today. Now, in diabetes over time, due to excessive sugar in the blood, your blood vessels get damaged. And remember, it's usually said that you only live as long as your blood vessel lives. So this simply means that diabetes affects the blood vessels of the eye first before any other damage is caused to the eyes. Apart from the blood vessels of the eye getting damaged, high blood sugar level can also affect the kidney, it can also affect the heart, it can also affect the brain, and it can also affect associated nerves. This is why people who have diabetes actually have wounds on their leg, and if the wounds do not heal very well or very fast, which can lead to amputation, which was actually the cause of the lady who came to my office previously. Exactly, because her nerves were damaged, she had a wound on her leg, it didn't heal on time, and her leg had to be amputated in order to prevent further spread of the infection. Now, the images you're seeing here, the one on the left hand side is a normal retina, while the one on the right hand side is a diabetic retina. So you can obviously see what happens in a diabetic eye. You can see the red patches, those things are blood. Exactly. Hemorrhage occurs on the retina. You can see the yellowish patches too on the diabetic retina. This occurs as a result of things I'm going to be explaining to you later on in this video as you listen and follow me. Now I'm exactly going to tell you how high sugar level can weaken the eyes and cause blindness. First of all, when a patient is diabetic, the blood vessels become very weak because of high blood sugar level. When the blood vessels become weak, boil-like protrusions occur on the blood vessels. It's just like boil appearing on the blood vessel. After some time, the blood vessels burst. And when these blood vessels burst, they release the contents they carry onto the retina. And that's what causes this yellowish patches on the retina. Exactly. So the first thing is, when your sugar level is high, it weakens the blood vessels. When the blood vessels become weak, boil-like protrusions known as microaneurysms appear on the body of the blood vessels. After some time, these microaneurysms or boil-like protrusions, they burst. And when they burst, they release their contents onto the retina, causing these yellowish-like patches on the which you're seeing on the diabetic retina. At this stage, The individual may or may not notice any changes in his or her vision. Exactly. This simply means that when all these processes are going on in the eye, some individuals may notice some symptoms, while some individuals may not even know that something wrong is happening in the eye. This is very bad. Vision changes in a diabetic patient usually starts between 15 to 25 years of the person suffering from diabetes, meaning that you can be diabetic and you won't notice that all these changes are occurring in your eyes until after 15 years. Wow. And after the first changes you notice, like the blurry vision, the night blindness, the floaters in the eye, the black spot, this can occur for as long as 10 years. Then after that, the next stage is the stage that leads to permanent blindness, which we're still going to be talking about. This is why it is very necessary for everybody, everyone who is diabetic, everyone who is pre-diabetic, or anyone who has history of diabetes in their family to always visit the eye hospital at least once a year for a dilated eye examination. This examination will help to detect these changes on time, and then you will be told on how you can stop the changes in order to prevent blindness. Remember, initially I said the blood vessels get weak and they burst. When they burst and release their contents, oxygenated blood is also lost from these blood vessels. And oxygenated blood is supposed to help nourish the eye. But when the blood vessels starts leaking, the eye begins to lack oxygen. That's bad news though. Now, to compensate for this lack of oxygen, the body produces new blood vessels. But this is not a good news. Reason. The reason is because these new blood vessels are very fragile and they can break easily, causing what we call hemorrhages on the eye. Hemorrhage, I can call it internal bleeding, and you know how bad internal bleeding can be. Now, this is just the beginning of the damage that is being done to the eye. When this internal bleeding occurs, or when the hemorrhage occurs on the retina, this blood after some time dries up. And when it dries up, it pulls the retina. The retina is the most sensitive layer of the human eye. It pulls the retina away from its support. The retina actually is supported at the back of the eye. But because the blood has dried up, this dried up blood pulls the retina away from the back of the eye. And this can cause symptoms like flashes of light. You can see the image on the left-hand side. Most of my patients tell me, Doc, whenever I close my eyes, I see something that looks like thunder passing my eyes. I understand. So if you started experiencing flashes of light, you need to see your eye doctor immediately. Apart from oxygenated blood leaking away from these blood vessels, fluid, water can also leak from these broken blood vessels. And this fluid flows straight to the macula. The macula is the part of your eye that helps you to see things that are right in front of you. It also helps to give you clear and very sharp vision. Now, when this blood flows to the macula, it makes the macula to swell up, and then that's when you notice symptoms like blurry vision, distorted vision, and when this occurs, it can lead to permanent blindness. So like I've said earlier on, you need to see your eye doctor when you start noticing any of these changes in your eye. It is paramount because we can help to stop further damage. Beyond all these symptoms I've mentioned, symptoms like blurry vision, black spots, floaters, flashes of light, distorted vision, night blindness, you are also at risk of developing what we call cataract if you're diabetic. Exactly. Apart from cataract, which is already known as the cloudy crystalline lens, you can also develop, or you can also be at a high risk of developing what we call glaucoma. Enough of talking about all this. Yes, I've talked about all the problems, all the complications that can arise in the eye because of uncontrolled or prolonged diabetes. And I know I've also told you that these changes that occur in the eye due to the diabetes is actually irreversible, meaning that it's permanent. I'm not here to scare you today, but I'm just here to educate you, widen your knowledge, and also give you a solution to this challenging problem. Yes, I've told you I have a solution. And what's my solution? Before I get to that, remember that for you to stop blindness from diabetic retinopathy, you need to stop diabetes first. When you're able to stop the diabetes, when you're able to control your diabetes, you automatically stop diabetic retinopathy. And when diabetic retinopathy is stopped, then that means you're not going to go blind again. This is good news. So to cap it up, controlling the root cause of increased blood sugar in your body which is reduced insulin sensitivity, can actually help to stop diabetic retinopathy. I repeat, controlling the root cause of increased blood sugar in your body, which is reduced insulin sensitivity, can actually help to stop diabetic retinopathy, thereby stopping blindness. So before I continue, I would love to tell you a few things I've discovered. Did you know that every 1 minute, 100 million cells die in the entire human body as we age? The mitochondrion, which is the powerhouse of the cell, also begins to function less, thereby causing reduced insulin sensitivity in the liver and the skeletal muscles where glucose is stored. Wow. Did you also know that they function less because NAD+, which assists in generating 95% of human energy and also prevents cell abnormal changes, is reduced? So what am I trying to say here? All I'm trying to say is that every 1 minute, 100 million cells die in the human body as the human being ages. Apart from that, the mitochondria, which is the powerhouse of this human cell, begins to function less. And when they begin to function less, it causes reduced insulin sensitivity in the liver and the skeletal muscles. Now, why is the mitochondria reducing? Why is it functioning less? We are being told that they function less because NAD, which helps to generate about 95% of human energy, has reduced. Wow. Let's not lose hope here. I'm telling you that because in 2013, David Sinclair, a professor of genetics from Harvard Medical School, carried out some research and he discovered something very, very beautiful. He discovered a star product known as NMN. NMN simply means nicotinamide mononucleotide. This is a product with anti-aging potential. This is the star product, NMN. David Sinclair, after he discovered the star product NMN, said that NMN is a precursor for NAD+. And like I said previously, NAD+ assists in generating 95% of human energy. The story is getting more interesting. Now, the statement above simply means that when you take NMN, NMN will produce NAD+. And when NAD+ is produced in the body, it will increase insulin sensitivity in the liver and skeletal muscle. This simply means that your body will be able to carry the sugar into the various parts of the body that needs it, thereby reducing the sugar level in the blood. This is wonderful. David Sinclair also discovered that our star product NMN corrects what we call dyslipidemia. And dyslipidemia is a condition where the cholesterol level in the blood is elevated. Therefore, the risk of diabetes, heart disease, and stroke has been doubled because of dyslipidemia. But David Sinclair said that NMN can correct this problem. Wow, this is getting very interesting. David Sinclair also said that NMN plays a vital role, together with lifestyle and dietary changes, to reduce the oxidative stress and inflammation in the body that causes insulin insensitivity. Wow. What he's trying to tell us here is that if you take NMN and you're able to exercise regularly, avoid alcohol, avoid smoking, and eat lots of healthy fruits and vegetables, you're going to be able to combat diabetes. Wow, this is the good news we've all been waiting for. This good news simply means that the rate at which your body converts sugar to energy will become faster. It's as simple as that. And this therefore gives NMN the potential to prevent diabetes and also help reverse the cause of diabetes, thereby preventing complications like diabetic retinopathy that can lead to blindness. This means that NMN works for diabetes and dyslipidemia. I'm sure a lot of us are getting more interested. A lot of us want to know how far is NMN, how can I get NMN, how much is NMN. Real value is priceless, I can tell you that, and you can bet on that, so that real value is priceless. I'm also here to say that health is wealth. If you're not healthy, you're not wealthy. Remember that if you don't also look after your eyes, you won't be able to see to work and you won't be able to make money. So now going down to how much NMN is, or how can you procure NMN. Currently on Amazon, like we all know, 3,000 milligrams of pure NMN costs only $1,038. But I can hear most of you saying this is quite expensive, Dr. Chioma, is quite expensive. Yes, I thought of that too when I saw this price on Amazon. Because when I heard about what NMN does in the body, I became particular about it. I became interested in it. So I started looking for some pharmaceutical companies that can give us pure NMN at an affordable price, but very effective. That was how I was able to find an American pharmaceutical company which actually agreed to seal this deal. They told me Dr. Chioma will be able to give you pure NMN, 4,500 milligrams of pure NMN at a cost of $150 only. Wow. When I saw this deal, I was like, Chioma, you've hit it. The American pharmaceutical company is giving us 4,500 milligrams of pure NMN for only $150. The good news here is that for the first 10 people to pay before delivery, they're going to receive my 4,500 milligrams of pure NMN at a price of only $85. Just because you're among the first 10 people to pay before delivery, you're receiving it at a price of $87, and you're going to be getting free delivery nationwide. Wherever you are in Nigeria, you're getting it free. Free delivery, no charge. But if you happen to get this our star product and decide to pay on delivery, you're going to be paying $95 only. But you're still going to be receiving the free delivery nationwide. However, after the first 10 orders, the price goes back to $150 only. So it's in your hands to make your choice. Payment before delivery is going to be $87 with free nationwide delivery. Payment on delivery is going to be $95 with free delivery nationwide. This is for the first 10 orders. But if you decide that you're not going to be among the first 10 people to place an order, you're going to get it at $150 only. Remember, all of this is to save your sight and your general health. If you would love to partner with me to save your sight and general health, then contact me on +234 8105 000 729. I repeat, if you would love to partner with me to save your sight and general health, then contact me on +234 8105 000 729. You can also follow me on my social media platforms for more eye health education. I teach a lot about your eye health. Trust me, you don't want to miss any of my teachings. And you know what? You're getting everything for free. So check me out on Facebook. Follow me on Facebook and LinkedIn on Chioma Innocent. On Medium, you can check for Dr. Chioma Innocent. On Twitter and Instagram, you can check at Dr._Snow White. And you can also check my blog at ihealth365@blogspot.com. Trust me, you're going to be getting all this information for free. You can thank me later for that. I really appreciate you for staying with me to the end of this video. Once more, I'm Dr. Chioma Innocent, your eye doctor, and I'm in love with your eyes. Thank you, and I hope to hear from you sooner than later. Bye.